In this episode of our clinical series podcast, we will be discussing a common medical condition known as anemia. Anemia is characterized by a decrease in the number of red blood cells or a reduced amount of hemoglobin in the blood, leading to a decreased capacity of the blood to carry oxygen to the body tissues. There are various types of anemia, each with its own causes and manifestations. The most common type is iron deficiency anemia, which occurs when there is an inadequate supply of iron to produce sufficient red blood cells. This can be caused by a lack of dietary iron, blood loss from menstruation or injury, or difficulty absorbing iron from the gastrointestinal tract. Another type of anemia is vitamin B12 deficiency anemia. In this case, the body lacks sufficient vitamin B12, which is necessary for the production of healthy red blood cells. The most common cause is pernicious anemia, an autoimmune condition that affects the absorption of vitamin B12 in the gut. Additionally, anemia can also be caused by chronic diseases such as kidney disease, cancer, or autoimmune disorders, where the body attacks its own red blood cells. This is known as anemia of chronic disease. The signs and symptoms of anemia can vary depending on its severity and underlying cause. Common symptoms include fatigue, weakness, shortness of breath, dizziness, pale skin, and rapid or irregular heartbeats. It's essential to recognize and address these symptoms promptly, as untreated anemia can have serious consequences on an individual's overall health and quality of life. To diagnose anemia, a thorough medical history, physical examination, and a series of blood tests are typically conducted. These tests measure the concentration of hemoglobin, red blood cell count, and other parameters related to blood function. Determining the specific cause of anemia is crucial in developing an appropriate treatment plan. Treatment options for anemia are based on the underlying cause. In cases of iron deficiency anemia, iron supplements may be prescribed to replenish iron levels in the body. Eating a well-balanced diet rich in iron sources such as red meat, leafy green vegetables, and legumes is also recommended. For vitamin B12 deficiency anemia, vitamin B12 supplements or injections may be necessary. In cases of anemia of chronic disease, treating the underlying condition often helps to improve anemia symptoms. Prevention of anemia involves maintaining a healthy lifestyle and balanced diet that includes essential nutrients like iron, vitamin B12, and folic acid. Regular medical checkups are important to detect any underlying health conditions that may lead to anemia. Thank you for your attention.